Control of coccidiosis, hygiene, sanitary measure like the removal of dirty bladder, wet. Control of coccidiosis, hygiene, sanitary measure like the removal of dirty litter, wet and kicking spots, the cleaning and disinfection of the equipment, and building at the end of each grow-out period will greatly contribute to the reduction in the contamination of the environment. Control anticoccidial compounds in the feed are the most common methods of control, however resistant to the anticoccidial, therefore ration of type of product may be used to prolong efficacy. No anticoccidial is highly effective against all species of coccidia, although some are effective against. Several anticoccidial are approved for prevention of coccidiosis: Ambrolia, Monensin, Polipidol, Nicarbazine, and others. Not all products might be able to be used for all poultry species. Turkey are extremely sensitive to salinomycin and narasin. Care should be taken in choosing the product to be used. Traditionally, anticoccidial have been divided into two categories based on their effect on the parasite: coccidiostatic and coccidiocidal. Coccidiostatic development of the parasite is stopped without destruction of the parasite, and coccidiocidal destruction of the parasite, as a few products present both types of the activity. Another classification was defined based on the mode of action, mode of production of these molecules to their action. Anticoccidial are also referred as chemical synthetic products, ionophores, and fermentation products. A number of products are available worldwide, and each product will present some well-established strengths and weaknesses. Anticoccidial may be used as a single product throughout the life of the bird straight program, or as a combination of products given one after the other during the life of the bird shuttle program. For straight program, ionophores are used in the majority of cases as the best compromise between the control of the disease and the gross performance of the bird. In shuttle program, a wide variety of combinations have appeared over the years, with the use of 2 to 4 different. Most popular is the combination of a chemical product during the first 2 to 3 weeks, followed by an ionophore product from 2 to 3 weeks, but the reverse option is also frequently used. The combination of 2 products given at the same time is also used as a means to improve anticoccidial control. Straight program will be used for a period of the year, and shuttle program for the rest of the year. All these systems highlight the complexity of the prevention of the coccidiosis. The monitoring of the performance of the program is critical for their long-term effectiveness, as the parasite will develop observed with chemical products or increase tolerance to antitoxin. Here, the molecule and the mechanism of action, and the dose, advantage and disadvantage, the Ambrolia, Polipidol, plus Polipidol, diclasorate. Vaccine. The first anticoccidial vaccine appeared in the 50s, and their usage was mostly limited to broiler breeder layers raised on the floor and turkey. Currently, the use of vaccine has increased tremendously, expanding to the broad use. Broiler vaccines are usually made of live strain of several Eimeria species. Eimeria cervellina, Eimeria maxima, Eimeria tenella are most commonly used. Commercial coccidiosis vaccines are available. Bland exposure of the young chicks or bullet to a small number of oocysts by coarse spray at the hatchery or in the feed, water or gel block, or in ovo at 15 to 19 days. Incubation has been used successfully. The number of oocysts of each Eimeria species provided in the vaccine is critical to initiating immunity. Without causing clinical disease, some vaccines contain drug-sensitive strains of Eimeria, facilitating the placement of the drug-sensitive population and extending the usefulness of the anticoccidial. Some vaccines may contain attenuated or precious line of Eimeria. Most vaccines are given during the first week of age, either by spraying at the hatchery, by water administration, by spraying on the feed, by incorporation into the gelatinous material placed at the hatchery in the box delivering the chicks. Natural exposure: if the chicken are exposed to modest number of oocysts in the environment, they develop immunity to the species of coccidia present. Exposure must be moderate or clinical signs will appear. Exposure can be limited if dry litter conditions are maintained. Wet litter, including wet areas around the waterer, is especially to be avoided. This parasite is rarely used in large commercial operations. Treatment: prevention is emphasized. However, chemical agents while used for treatment, including ambrolium, sulfa-dimethoxam, sulfa-penoxalate, sulfa-mezamine, sulfa, should not be used in layers. Required drop in egg production. Required withdrawal time are usually required prior to marketing. Increasing vitamins E and K in feed or water may reduce mortality and hasten recovery. Specific management of the flock and its environment will be required to achieve a low background cycling of the parasite in the bird, allowing for the development of immunity. Coccidiosis in Turkey. 7 species of Eimeria have been described in Turkey. In USA, the 4 pathogenic species are Eimeria adenoides, Eimeria grammatis, Gallo bovins, and dispersa. Non-pathogenic: Eimeria pinocchia, Eimeria gritis, subrotunda. Coccidia in Turkey resembles the disease in chicken. The diarrhea may be watery, mucoid, and bloody, and mortality may occur. Eimeria grammatis and Eimeria cause spotty congestion and petechial from duodenum to ileum, dilatation of jejunum and mucosal cast. Dispersa produce a creamy colored serosal surface, dilatation of the intestine, yellowish mucoid feces in middle 1/3 of the intestine. Eimeria gallo-bovonus. Eimeria gallo-bovonus causes edema, ulceration of mucosal ileum, yellow exudate, and fleck of blood in feces. Lesions are principally located in the posterior 1/3 of the intestine. Adenoides. Adenoides affect the posterior 1/3 of the intestine and is responsible for the liquid feces with mucus and fleck of red blood.